Hello everyone, welcome back. I hope everyone is safe and sound. I'm Pavan Sriram. In this video, I'm going to talk with Professor Svenn-Erik Mamelund on how to deal with COVID-19 based on the lessons learned from history. Professor Svenn-Erik has been studying demography and consequences of influenza pandemic.
Okay, nice to talk to you, Pavan. My name is Svenn-Erik Mamelund, and I'm a research professor at Oslo Metropolitan University, and I have done research on influenza pandemics for the last 25 years, in particular the so-called Spanish influenza pandemic of 1918, and I've been particularly interested in the social risk factors for influenza and the social and economic consequences of pandemic influenza.
What are the lessons which we can learn from the Spanish flu in terms of COVID?
That's a really good question. Most journalists ask me that question, and this time I like to do a little twist on it. I like to ask the question, what did we not learn from looking at history? And I think there's at least three things that I want to bring up to the table. First, I think most of the leaders across the globe, and perhaps also even public health people, politicians, and even academics, did not believe that we could have a new pandemic, which was so terrible in terms, especially of the impact on the economy of the lockdowns, but also having a new disease with quite a substantial disease burden as well. So it shows that these big pandemics and these crisis years with high impact mortality that we had back in the 19th century or 18th century, they are even possible today. So these pandemics do not only belong to history. That's the first thing. I don't think that we have learned, but now we need to learn that this is something that can happen also again and in the future. And the second thing I don't think that we have paid too much attention on is the fact that these epidemics or pandemics are not only confined to developing nations. This is something that can happen also in developed nations, in high-income countries. That's the second thing that I think we haven't dared to say or admit, that this can happen. It can happen again. This is not something that belongs to history, and this can also happen to rich countries. And the third thing that I think we haven't been able to deal sufficiently with here and now during COVID is how to protect the socially vulnerable people. So you see, for example, there are lots of studies now showing that Black people, for example, in the United States, are suffering more cases, being hospitalized to a larger extent. They are having higher mortality and so on compared to white people. You see the same in the UK. There are also, even in the Nordic welfare states, we see that some immigrant groups are disproportionately suffering more from the virus, and also some of the consequences of the lockdown. So this is something we have seen also in the past, and once again we are not able to protect these vulnerable people.
Moving to the second question, the Spanish flu is known to be one of the deadliest virus we ever had, and with COVID, is it here to stay, or is it going to kind of last for long, or what's your opinion on that?
The Spanish flu pandemic came in 3 to 4 waves and lasted for almost 2 years. So people didn't have it equally, in the same equal in terms of morbidity and mortality at the same time. So some regions had, for example, just one wave. Others had 2 or 3 waves, and some people, for example, people that didn't have experienced with the flu in 1918 or 1919, had it in 1920, right? So we can at least suspect now that this virus will also be plaguing us for at least the next year, and it won't go away. Although we get a vaccine, this is not something that will go away. It will perhaps eventually just be with us. We will learn to live with it, and a vaccine will be helpful, but it will perhaps not be available to everyone. So and eventually it will turn into a virus that just belongs with all of the other seasonal viruses that are hitting us every winter, like the influenza.
There is always a talk, and we all know that there's millions of viruses which exist in our planet, and there has been efforts made to hunt them down, and there's a talk about this universal X vaccine. What's your take on that?
Yeah, that's been a wet dream among virologists, making that one single vaccine that can protect us forever, against all types of viruses. I think, you see how difficult now it is to make a new vaccine against the new virus, against the SARS-CoV-2 virus, and how difficult that is. We struggle a lot on making that one, and it's even more difficult to do a vaccine that is going to be a universal vaccine, protecting us against any type of influenza virus, for example. So I think there's going to be many years before we see a company, being successful in making universal vaccines.
Yeah, this was more related to the vaccine development itself. There's a rush right now across the globe who is going to release the vaccine. There are 9 of them in the phase 3 trial. We could see that the AstraZeneca and the University of Oxford one, it had a stoppage for a few days in the trial because one of the patients got sick. So what's your opinion about racing towards faster development of vaccine? Is it a healthy thing or is it still unknown? And because with Spanish flu, it took nearly 20 years after the virus had actually impacted the population. In here, we are trying to really create a vaccine as fast as we can. So what's your opinion on this?
I've been in my home office for the last 6 months, and I like to sort of go back to the pre-pandemic normal for sure, and I think developing a vaccine can sort of help me get me and others out of the out of confinement, so to speak. So no, so of course we need this race. We need to do it quickly. You see, we haven't. I mean, this pandemic is not over, right? So if you talk to me in 2 years, we will have more information, more data on how serious COVID was in terms of how many people it infected and how many people eventually died of it, right? And for sure, we need a vaccine to prevent further infections, hospitalizations, and deaths. But of course, at the same time, you need to think about safety, and that's why they stopped this vaccine that you just talked about, in Oxford. So it's all about safety as well. But we do need a vaccine for sure.
So you talked about different viruses impact different population differently. So how important is public health, and why it is important that now many of the population should go into public health education?
Yeah, that's a good question as well. I think the situation now is showing that public health is not only about having enough masks or equipment to protect our healthcare personnel. And it's not only about antiviral drugs or vaccines. We don't have a vaccine right now, right? And we don't have antiviral medicines. So it's actually more about understanding and understanding how non-pharmaceutical interventions are working. Everything from hand washing to social and physical distancing measures and so on. So it's about understanding how these measures works and whether and also understanding how it can sort of control the virus and the spread of the virus, but also the negative consequences, of course, of lockdowns is now part of public health.
So what's your message out there for the future students who are interested in this particular subject?
It's that you should go for a transdisciplinary education or an interdisciplinary education, because thinking about COVID or the Spanish flu pandemic 100 years ago, or a future pandemic with maybe an unknown pathogen X, you need to think more holistically. You need to think about these diseases as, it's a medical phenomenon, of course, but it's also a social phenomenon. So you need to think about risks during pandemics, both as a medical and a social phenomenon.
The question is about this running around like this particular virus has been developed in the labs in Wuhan, and there is this professor or there's a person from Hong Kong. She's a virologist, and she's been working in Hong Kong on this, and she claims she's right now in the US, and she claims that there is she has a scientific backing or knowledge on this has been developed in the laboratory. What's your take on that?
Yeah, well, there's always rumors and conspiracy theories on vaccines and viruses. My take on this is that if you look, I have studied pandemic history, and it turns out that we have had these influenza or coronavirus pandemics for a number of decades. We have, or centuries, I would say. We have at least 3 to 4 pandemics each century, and this goes for the last 500 centuries. So these pandemics have always been around us. So I mean, this century we have had 2 pandemics. The so-called swine flu pandemic in 2009, and now we have the second pandemic of this century, the COVID-19 pandemic, and we will for sure have at least 1 or maybe 2 or 3 more pandemics this century. So they have been around us for centuries. So it's not something that we can sort of. I don't think there's a high likelihood that we can prevent them altogether. This is something that is going to come with us either way, Pavan. So yeah, so that's sort of my answer to your question. These things have been around us for centuries, and they will come and beat us again.
I hope the discussion with Professor Svenn-Erik has been useful and provided you with useful insights on the historical perspective on such pandemics. As he said, at least 2 to 3 pandemics have been occurring every 100 years. So there's a lot of data and knowledge from which we can learn and build a resilient and robust mechanism moving forward. I hope you also watched my video with Dr. Chetan on the facts about COVID-19. If not, kindly do so. In my next video, I'm going to talk with a fellow who is working on vaccine development that can give you a complete picture on pandemics and COVID itself. Until then, take care. See you all soon.